Imagine walking into a clinic with a simple stomachache, only to have a man with unwashed hands tie you down and slice open your arm with a rusty blade. Before modern anesthesia and basic sanitation, attempting to cure an illness was an agonizing game of survival, where the treatment was often more lethal than the disease itself. The cozy, romanticized version of the Middle Ages that we see in movies is a complete myth. There were no sterile operating tables, no white-walled clinics, and absolutely no certified doctors available for the average peasant. Medical care was entirely improvisational. The environment people lived in practically guaranteed they would get sick. Every morning, villagers dumped their human and animal waste directly out of their windows. This created bubbling, toxic rivers of feces, urine, rotting food, and dead rats that flowed right through the center of town. This street sludge mixed with rainwater and washed directly downhill into the very wells the village used for drinking water. Consuming this contaminated water meant the average person hosted intestinal parasites their entire life and faced constant outbreaks of dysentery, a severe, dehydrating intestinal infection. To avoid dying from the water supply, everyone, even young children, survived almost exclusively on a weak, low-alcohol beverage called small beer. The brewing process required boiling the liquid, which accidentally killed off the deadly bacteria and made it the only safe thing to drink. This image shows a close-up of a toxic black fungus called ergot growing directly out of a head of rye grain. Because peasant bread was typically made from cheap, low-quality rye flour, this fungus easily slipped into the food supply. Families who unknowingly ate infected bread fell victim to ergot poisoning. The fungus triggered terrifying hallucinations, caused their limbs to develop tissue rot, or gangrene, and ultimately led to a deeply agonizing death. Everyday acts of eating and drinking were biological minefields. Debilitating sickness was an inevitable baseline reality of life, forcing desperate people to seek out whoever they could find in a totally unregulated medical vacuum. Real doctors worked exclusively for kings, queens, and bishops. The average person relied entirely on the village multitasker, the local barber-surgeon. In between cutting hair and sharpening kitchen knives, he pulled teeth, drained blood, and performed amputations. The concept of cross-contamination did not exist. A barber-surgeon would casually use the exact same wooden bucket to brew his own homemade beer as he did to catch severed limbs and pooling blood during a surgery. Soap was considered a luxury, meaning he practically never washed his hands. He wore no gloves. His surgical tools looked suspiciously like garden shears and butter knives, and they remained covered in the dried, crusty blood of his previous patients. When you walked into a shop, he wouldn't check your pulse or ask about your diet. Instead, he would ask for a sample of your urine. He'd hold the warm vial up to the light, stare deeply into it, and sniff it, guessing what was wrong based entirely on the color and smell. This manuscript reveals their diagnostic approach. Centrally, a physician inspects a urine flask, applying humoral theory. This theory claimed the body was controlled by 4 magical fluids: blood, phlegm, yellow bile, and black bile. The surrounding 20 flasks mapped exactly which fluid was misaligned. Because every single illness, from a common cold to a lethal fever, was incorrectly diagnosed as a fluid imbalance, the treatments were never designed to heal the patient. They were designed to violently drain them. To manually rebalance your humors, the barber-surgeon deployed the gold standard of pre-modern medicine, bloodletting. He'd tie a rough rag tightly to make the veins bulge, grab a rusty, unsterilized blade, and slice you open. You likely entered his shop already dehydrated from your stomachache, and now you're leaving with half your blood volume drained into a dirty bucket. The physical toll was massive. Patients would instantly feel cold, dizzy, and incredibly weak. There was roughly a 50% chance he would simply pass out in the wet mud outside his shop, completely defenseless. If the blade failed to cure you, they reached for specialized equipment. This antique ceramic jar and the surrounding metal bowls were used to store their next medical marvel, live leeches. These slimy, parasitic worms weren't kept in sterile containers. They squirmed around in dirty, stagnant water that had previously been used as someone's old bathwater. The barber surgeon would slap a handful directly onto your bare skin, leaving them to gorge on your blood until they grew fat and fell off. Even if you managed to see a highly educated professional doctor during a massive crisis like the Black Death, the medical response was equally horrifying. Plague doctors walked through infected streets wearing creepy bird masks with long beaks stuffed full of aromatic flowers. They believed diseases were spread entirely by miasma, or bad smells, meaning they considered sniffing sweet-smelling flowers to be the peak of scientific defense against the plague. Whether you were sitting in a peasant barber-surgeon's chair or receiving elite plague care, the result was the same. The very interventions meant to save you actively destroyed your immune defenses exactly when you needed them most. When draining your veins and applying parasites inevitably failed, pre-modern medicine had one final resort: superstition. If the treatments didn't work, the logical conclusion was that you had either angered God or you had been cursed by a local witch. Suspected curses triggered a lethal societal failsafe called a trial by ordeal. The patient would be tied up and thrown straight into the local river. If you sank to the bottom and drowned, God had cleared your name. If you managed to float, you were deemed guilty of witchcraft and promptly executed anyway. The tragic irony of this entire medical nightmare is that the ailments people were so desperately trying to cure were almost always caused by the filthy, parasite-ridden environments they built for themselves. For thousands of years, our ancestors endured this brutal reality. A simple infected cut or a bout of food poisoning was a potential death sentence in a world with no antibiotics and no emergency rooms. They fought through starvation, relentless diseases, and terrifying medical treatments so that their descendants could survive. Every time you take a sterile antibiotic or receive pain-free medical care, you are benefiting from the agonizing gauntlet past generations endured to keep the human timeline going. If you're glad you don't have to visit a medieval barber-surgeon for your next checkup, make sure to hit that subscribe button before natural selection decides to pay you a visit.